Welcome to the Vital Spirit podcast. I'm Dr. Kelly Livingston, a naturopathic physician and your guide to a new health reality, one that connects body, mind, and spirit. Together, we'll dive deep into the art and science of holistic healing. Through working with hundreds of women through midlife transitions, I've discovered something profound. Most of our physical and emotional challenges are rooted in a maladaptive stress response, and true healing begins when we regulate our nervous system. Each episode will explore complex health topics in simple, empowering ways, uncover the deeper wisdom within each of us, and share practical tools for nervous system regulation to help you awaken your vital force and create lasting wellness. So, if you're ready to reconnect with yourself, your health, and your purpose, let's begin this journey together so you can experience life more fully human and deeply healed. Hi, and welcome back to the Vital Spirit podcast. I'm Dr. Kelly Livingston. Before we begin today, I want to zoom out for just a moment and remind you of the framework that this conversation lives inside. In my work, I teach something called the Seeds of Health. Episode 7 was all about the seeds of health and your health philosophy. The seeds of health are the daily foundational habits and practices that create the terrain for healing to occur. They're not just protocols, they're not biohacks, they're essentially the plants. I like to use this idea of seeds of health being these plants that we water every single day. Now, some patients might be focused on one seed of health more at any particular moment in their health awakening journey. That's essentially kind of some of the art of being a naturopathic physician, is utilizing labs and symptom picture and a patient's unique health history and story to decide, okay, what plant do we need to water the most? What seed of health are we focusing on? But throughout our work together, we are going to absolutely touch on each seed of health. So the seeds of health include mindfulness and breathwork practices, hydration and hydrotherapy, lymph love, food as medicine, movement, which is today, relationships and community, spirit and time and nature, and sleep, play, and relaxation. So I've had episodes on hydration and hydrotherapy. We're moving into movement today. I had an episode on mindfulness. And as I go through the next year of the podcast, we're about to be in year 2, I will have more episodes devoted to these seeds of health. As always, you can go and download your own unique seed of health journal, unique in the sense that you're going to fill it out, but it gives you guidance on each one of these, actually quite a bit of guidance, and you will fill out what is a priority to you. You can fill out some of the reflections and prompts. And even if you're not a patient working with me or you're not participating in any of my group programs, you will benefit from utilizing this journal. So go download that. It's free. And movement is not a standalone topic. It really touches every other seed of health, which I think you'll see in this episode. How you move your body every day affects your nervous system, your hormones, your digestion, your immune system function, your mood for sure, your sleep, your metabolism, brain health, and certainly your resilience. So today we're coming back to one of the most foundational seeds of health. They're all foundational, right? That's why I selected them. But we're going to talk about movement today. And I want to be really clear from the beginning. This episode is not about workouts. It's not about fitness culture. It's definitely not about punishment, hustle, or pushing through exhaustion. Some of my patients who struggle with chronic fatigue, for example, cannot move their body. There's a lot more to movement, especially if we're unable to actually exercise or exert ourselves physically. So this is about movement as medicine, and movement is medicine. And those are two different things. Before we talk about the differences, let's ground ourselves for a moment. So let's pause and take a breath. Ready? We're going to inhale and exhale. Feel your body where you're sitting right now. Notice any places that feel tight, heavy, restless, or even stuck. Because this is really where the conversation begins. Movement is not about just fitness. It is about restoring flow, and it absolutely is about connecting with our body. Wherever there's stagnation in the body, healing becomes more difficult. Remember, stagnation is a breeding ground for disease. So, just by tapping in for one brief moment and sensing where we might have stagnation, tightness, right, in our body is part of the healing process, acknowledging that place and just breathe into it for a moment. Okay, so what do I mean when I'm talking about movement? When I'm talking about movement as a seed of health, I'm not talking about exercise, like I said, in the way that most of us are taught to think about it. And I find that if I jump right into exercise as a seed of health, it really is a turnoff for a lot of people. So, movement is not just workouts, gyms, calorie burning, or pushing ourselves, but movement is any action that restores communication and circulation in the body. So, that's going to include movement of our muscles, movement of our blood, movement of our lymphatic system, which remember is detoxing and moving adjacent to our circulatory system, movement of our breath, movement of our digestion and our elimination and our emunctories, our organs of elimination, moving things through, movement of our emotions, and movement or nervous system signaling throughout the body. So I would consider that electrochemical movement as well. If something in the body feels stuck, one of the first questions I ask clinically is not what supplements do we add? What pill can we take? But what is not moving? Movement is one of the most powerful ways we can communicate safety, rhythm, and vitality to our body and our mind. And this matters even more in midlife, especially during perimenopause and menopause when chronic stress, burnout, anxiety, depressions, autoimmune conditions, and metabolic issues can flare. Now, I want to go back to that important distinction between movement is medicine and movement as medicine. Movement is medicine refers to the daily foundational practices and habits that every human nervous system requires to stay regulated and resilient. These are things like walking, daily movement that elevates our heart rate, gentle stretching, and weight bearing exercises, breath led movement, time outside in nature, rhythm, and consistency to this movement practice. These are part of the Seeds of Health framework for a reason, right? We're doing these things every day, some form of movement. Movement as medicine refers to the intentional therapeutic movement used to support healing. So this might look like yoga, constructive rest pose, pelvic stability work, psoas release, somatic experiencing, fascia work, working with a chiropractor or an acupuncturist, working with a physical therapist on specific movements, or maybe a Feldenkrais practitioner. Cranial sacral therapy is something that I do with some patients in my practice, and other body based therapies or hands on body work. Manual therapies and body work approaches that are supporting the system's ability to move and unwind are what I'm referring to in this category. And both of them matter. So our daily movements matter, and utilizing movement in more medicinal or therapeutic settings matters as well. But I do find that without the foundation, so without going home and actually doing things with and to our own body and learning our body, some of those therapies might not hold. So you might find that you have to go back over and over again to get that treatment or therapeutic movement as medicine or is medicine. So this is really straight out of naturopathic philosophy and the therapeutic order, right? Moving our body is going to be foundational. It's going to be part of removing obstacles to cure and creating the conditions for health. And sometimes we might be actively working on structural integrity. We might be actually seeking out more hands-on therapies. So now I want to move into talking a little bit more about movement and its impact on mood and depression, because we just had a whole series on depression. So make sure you go and check that out if you haven't listened to it yet. And I want to be really explicit here. Movement is one of the most powerful interventions we have for depression and low mood. And this is not my opinion. A large 2024 BMJ systematic review and meta-analysis on exercise for depression found that physical activity significantly improved depressive symptoms, with certain modalities showing particularly strong effects when practiced consistently. There's also a major umbrella review in the British Journal of Sports Medicine that analyzed a huge body of randomized controlled trials, and it found that physical activity reduces symptoms of depression and anxiety across many different populations. This matters because depression is not just a brain issue, right? Remember our inflammatory depression episode. Depression is inflammatory, metabolic, nervous system driven, mitochondrial, relational, and hormonal. And movement touches all of these layers at once. So, what's the cost of not moving, especially through perimenopause and menopause? Well, lack of regular movement is one of the primary drivers of chronic disease. So we're going to see higher risk of osteopenia and osteoporosis. As we get older, our bone density is something that we do focus on, especially at Root State Medicine. When I'm working with women who maybe want alternatives to having to go on a medication, we are working on reversing bone loss all of the time here. Insulin resistance and blood sugar dysregulation. So, when you're not moving your body, you are going to see more blood sugar dysregulation throughout the day, depression and mood instability, cognitive decline, much higher risk of cognitive decline, which we'll get into some more in a few minutes when we're not moving our body, cardiovascular disease. Most people know this, that moving your body is good for your heart health, right? Certain cancers, and definitely injuries and falls as we get older. So, the saying that sitting is the new smoking is not just a catchy phrase. It is a true clinical reality. If you are not moving your body, it is one of the first seeds that we're going to water. So, if this feels overwhelming to you, let's talk a little bit about micro movements and how humans were actually meant to move. One of the biggest misconceptions is that movement has to happen in one long block of time. And this can often be a barrier to making this change in our daily lives. We think, oh, I don't have time for that. I don't want to go to the gym. I don't have time for a yoga class, right? But our bodies are designed for frequent low dose movement throughout the day. This is where micro movements matter. I post about this on social media just as a little reminder, like get up and move your body. I need to do it. You need to do it. We all need to move our bodies. So some examples of this might be standing and squatting while you're brushing your teeth, calf raises at the kitchen counter while you're cooking, lunges while the coffee's brewing, shoulder rolls and spinal twists between meetings, walking while on phone calls, taking the stairs when you can, setting a timer to move every 30 to 60 minutes. There's been some amazing research on just moving for 5 to 10 minutes every 30 to 60 minutes. You can go check that out. And the point here is that habit stacking becomes really powerful. I'm not saying spend your day like running around like a crazy monkey, like I got to squat, I got to do this, I got to do push-ups over here, I got to do walks over there. Find a rhythm that works for your daily routine, but make sure that when you're doing something else, you weave some movement in, and it takes a lot of the pressure away, and it makes achieving watering that seed of health so much more doable. So if you're one of my midlife women and you're short on time and you don't have time to add something new and you're going to say, Dr. Kelly, I don't have time to do that. Well, you can attach movement to something that you already do. So movement doesn't need motivation when it's already woven into daily life. And this really matters for mood as well, because prolonged sitting is associated with worse metabolic function, worse inflammation signaling, and increased depression and anxiety risk over time. So let's talk about some concrete practical tips to increase your movement and bring it down to earth. Because when we talk about movement as medicine, people do really often find this as a barrier and something that they're resistant to. But these most powerful movement habits don't come from doing more. They come from doing things a little bit differently. So here are some simple ways. You can go back to this list later. Share this list with a friend who maybe needs to move a little more, or a family member who you're working on motivating a little bit, and build movement into your day. And hear this as permission to make it fun, make it playful, not as pressure. So I mentioned taking the stairs. That's an easy one if your knees are able to do that. You can park farther away from somewhere when you're walking, say to a store, you can park farther away. You can use a basket instead of a shopping cart. You can stand instead of sitting when you can, or if you're someone who has to do a lot of work at your desk, you can get a walking desk. This is a great tip for a lot of my patients that do a lot of computer work. You can do push ups against the kitchen counter or even on the floor if you have the strength for actual full push ups while you're cooking dinner. You can go for a walk with a friend instead of meeting for coffee, or definitely instead of meeting for a drink. So, holding walking meetings is a strategy of mine. I love, if I'm just on a brief phone call with a patient, just stepping outside and moving my body, looking at the water while I take that phone call. You can certainly take an extra lap around the grocery store. Just take one more little loop before you leave and set an alarm for every 30 to 60 minutes, as I mentioned a couple minutes ago, to get up and move your body. This can be a dance party break. In my house with my daughter, we like to do these little dance party breaks. Not that she's at home working with me, but I find if she's trying to do a project or work on homework, having a little dance party break brings some joy, some movement, some increase in circulation to our brain. You can walk your dog if you have a pet. I miss my Rottweiler so much for this purpose. He really motivated me to move. We got outside to the beach even almost every day in the winter. So this is not about intensity, these recommendations, right? This is about frequency and consistency. And this is how we're really designed to move. Move after you eat as well, because when we're focusing on balancing blood sugar and creating optimal insulin and glucose throughout midlife, moving our body after we eat is one of the best habit stacks I can think of. I think that might be one of the more misunderstood pieces of advice I give, where I say, make sure that you move your body, especially after heavier meals or meals that are higher in carbohydrates. There's research on post-meal movement that shows that even a short walk after eating can reduce the post-meal blood sugar spike compared to staying sedentary. Why does that matter for mood specifically? Well, because remember, blood sugar swings worsen anxiety, irritability, fatigue, and low mood. Now, as far as chronic complex illness or just prevention of illness as we get older, right? Focusing on optimal health. Well, remember that when your muscles contract, they're going to pull glucose from your bloodstream and bring it into your cells. And that's going to improve your insulin sensitivity, and it's going to reduce inflammatory signaling. And the name of the game is always reducing inflammation, right? We need inflammation in response to acute stressors or injury, but we don't want chronic inflammation long term. And this is, again, movement acting as both metabolic medicine and emotional medicine. So it doesn't need to be intense. It just needs to happen. I think culturally we've gotten very lazy, and we have a lot of things in life now that kind of make life easier, quote unquote, easier for us. Things are literally right at our fingertips. So we're just not moving as much. So let's talk a little bit about heart rate, hormesis, and not overdoing it. So from a foundational health standpoint, most adults are going to benefit from at least 30 minutes of moderate movement 5 days per week, or roughly 150 minutes per week. This is the classic public health baseline that supports cardiovascular health, metabolic health, and brain health. This could look like brisk walking, ideally outside, cycling, swimming, dancing, hiking, paddleboarding, one of my favorites, or yoga flows that elevate heart rate. The key word here is hormesis. So what does that mean? Hormesis means the right dose of stress that creates adaptation and resilience. Too little movement leads to stagnation. Too much movement becomes another stressor. And this is really critical in midlife. Exercise can absolutely become too much, right? I've been there before myself when I used to train for triathlons in my 20s. This is not a thing I do anymore. Or, for example, when movement is used to override emotions, to numb stress, or to avoid being still. I'm always talking about getting quiet and listening to our inner knowing. Well, if we're constantly moving, we can't do that. And excess movement can certainly push our nervous system deeper into dysregulation. So if exercise is worsening sleep, increasing your anxiety, disrupting hormones, or leaving you feeling depleted instead of energized, then the dose is probably wrong for you. Healing movement should leave you feeling more embodied, not less. So I want to spend a couple of minutes here talking specifically about weight-bearing movement in perimenopause and menopause, because women are either underinformed or pushed way too hard. And I think that this is a loud piece of advice that's floating around social media, and I think it stresses a lot of women out. So During perimenopause and menopause, declining estrogen affects bone remodeling, muscle mass, connective tissue, and insulin sensitivity. We've talked about this before. And this is why we see increased risk of osteopenia, osteoporosis, sarcopenia, injury, and metabolic shutdown. So the key point here is that bone needs load and muscle needs resistance, but the nervous system also needs safety. So weight bearing does not automatically mean heavy weights or intense gym culture, powerlifting. It can for some women if that works for you, that's great. Weight bearing simply means your bones and muscles are working against gravity. So some examples of that might include walking, hiking, stair climbing, squats and lunges, carrying groceries, using resistance bands, body weight plyometric exercises, light to moderate dumbbell use, or yoga poses that load the arms and legs. And in midlife, I definitely find that strength matters more than cardio alone because strength is going to protect bones, metabolism, long term independence, and confidence in your body. So, a gentle, sustainable baseline for many women I work with looks like 2 to 3 days per week of strength or resistance work with load, 20 to 30 minutes per session at least, and full body focus. So, using your big muscle groups. So, not just doing a bunch of bicep curls, but actually doing push ups, pull ups, squats, or lunges. And here's the nervous system piece. If your nervous system is already dysregulated, your sleep is poor, cortisol is high, or your recovery is compromised, so maybe you're not resting, you're not taking those Epsom salt baths, or taking some time for yoga nidra or a calming yoga practice, too much intensity can backfire. I'm very careful with my own exercise routine to have a lot of balance because I like powerful vinyasa flows, but I also have to take time to rest, restore, and recover. If strength training or cardio or high intensity interval training is worsening symptoms like anxiety, sleep, joint pain, or fatigue, that's not your body failing. That's your body asking for a different dose. And this is something that I hear a lot from women at midlife who are maybe those weekend warriors or women who've never taken time out of their exercise routine, that they're starting to notice that there's more pain attached to their exercise routine. And that's usually a sign to pull back. So bone density especially responds best to progressive, consistent load over time, not shock or extremes. And starting where you are and building gradually, repeating consistency and recovering well is really key. And remember, there's also a psychological layer here. Feeling strong supports our mental resilience as we get older. Strength is not just about chiseling our body or even muscle growth, but it's about staying capable and grounded in your body. I had a patient the other day who had come to me, I guess about almost 2 years ago now, maybe a year and a half ago. And she became a patient with her son. Her daughter-in-law was already a patient. And their goal was increasing her bone density. She had osteoporosis and she's in her late 60s. So it's normal for her bone density to decline about 2% every year. And in working together, we've actually found that her bone density got better by about 4% in her femur, which is awesome because your hip is a place where you can have a lot of injury, and that top of your thigh bone, your femur bone, is where a lot of times older women can fall and break that bone. So we were so excited to see such a wonderful increase in her bone density. We did utilize some supplements, we did dietary changes, and we worked a lot on building her bone density with muscle mass and exercise. Okay, so now I want to shift gears a little bit. This is something I talk about in the movement module of my Burnout to Balance group program, and that is the psoas muscle. And I call this the nervous system muscle or the muscle of the soul. So we can't talk about movement without talking about the psoas. The psoas muscle connects the spine to the legs, so it's really the bridge between your upper and your lower body, and it interfaces directly with your diaphragm. So I haven't done the breathwork part of the mindfulness and breathwork seat of health. I only did mindfulness, but when we talk about our breathwork, we're going to talk a lot more about the diaphragm. The psoas is deeply tied to fight or flight physiology, which we've talked about in every single episode. So when our sympathetic nervous system is activated, the psoas muscle contracts and gets tight and small. When we consciously release and relax the psoas, we send a powerful signal to the nervous system. You are safe. And if you've listened to any of our previous episodes, you know how important that message of safety is to healing. In Taoist medicine, the psoas is sometimes called the muscle of the soul. The balance between strength and release in this muscle influences your posture, your emotional regulation, and your sense of groundedness. So, what's something practical we can do to give some love to that psoas muscle? Constructive rest. This is medicine in stillness. One of the most powerful practices that I teach patients is constructive rest pose. You can pause this maybe and go find somewhere comfortable that you can lie on the floor, or come back to this if you're driving or walking while you listen. I know a lot of you walk, which is perfect, right? That's a great movement. But also, we're going to talk about resting in this episode too. So, constructive rest. So, you're going to lie down on your back with your knees bent. So, you're going to lie on your back, bend your knees, and place your feet on the floor. And leave your natural spinal curve intact. So, don't try to change anything. Now, while your feet are on the floor, you're going to knock your knees in. So you're going to have your feet on the floor wider than your knees and let your knees fall in and come together. This is constructive rest. You can lay here for about 10 to 15 minutes and just breathe, relax. Don't try to change anything necessarily. If you have a more advanced breathwork practice, you can engage your diaphragm and start some belly breath here. And this position is going to allow the psoas to soften, the diaphragm to relax, and the nervous system to downshift. This is movement without any effort on your part, and it is profoundly healing. You may have seen videos that I've shared before around achieving a craniosacral still point on your own. You can use some exercise balls to do this. You can go back and look for those videos on my Instagram page. But today we're going to talk a little bit about some pelvic stability and flow that you can achieve in this constructive rest pose. So pelvic stability work is going to restore core balance, spinal alignment, safe movement patterns in the body. And I find that a lot of women don't do any sort of pelvic tilt or rotation exercise. So when you're in that constructive rest pose, you can start to just move your hips around a little bit and start to restore flow and movement through the pelvis and spine. And this is really important for low back pain, for trauma histories, and maybe processing emotions like we've talked about in some of our recent episodes, hormonal regulation, for digestion and elimination. I talk a lot with patients about putting a small yoga wheel underneath your sacrum. So there's a lot that you can do when you're just laying on the floor with your feet on the floor. It is one of my favorite techniques to teach patients because we can go a lot of different amazing places with such a simple tool and exercise. So this is a great little segue into yoga and yoga as nervous system medicine and parasympathetic tone support. You know, I'm going to talk about yoga. I'm a yogi. Yoga is probably one of the most profound healing modalities that I've had in my own health awakening journey, both physical, mental, spiritual, emotional healing. So yoga deserves special mention. It's not just stretching. It integrates movement, breath, awareness, rhythm, and nervous system regulation. And that's not even me getting into the philosophy and essentially the self-study and spiritual study that yoga has meant to me. But just in thinking about yoga as a piece of our movement puzzle, let's really think on the research for a minute. And research on yoga there's so much of it. And what I think is so interesting is that there's specific language in the scientific literature that suggests that the physical and mental health benefits of yoga are so established and profound that it becomes essentially ethically questionable to assign participants to inactive control groups, and that shorter daily practices should be studied for cost effectiveness and real life implementation because the health benefits of yoga are just so profound. So it is going to benefit your mood, your quality of life, your autonomic regulation. There are so many physical benefits: heart rate variability, cardiovascular health, inflammation. So it's a really strong statement, right, to say that it's almost unethical to not include patients in the yoga arm of a study. So, in other words, yoga is not just exercise, it is a therapeutic modality. Yoga can support our mood, enhance our sleep, help with our digestion, give us resilience, and help us to deal with stressors of the day, major life stressors for sure. It's going to enable our body to get in and out of parasympathetic as it needs to. It's going to help with trauma recovery. And from a vitalistic lens, yoga works because it helps the body remember safety, and it is truly a mindful practice. Now, yoga and linking breath to movement is not exactly the same as just stretching. So if you are just turned off by the idea of yoga, then I do want to mention specifically stretching because it is often undervalued. And it's not just about flexibility. So a lot of times patients will say, oh, I can't even touch my toes, right? But it's about restoring flow and giving support to the muscles that is not support in the sense of contracting and load bearing weight on the muscles. So, gentle, intentional stretching can improve performance in physical activities, decrease risk of injuries, help your joints to move through full range of motion and activities. It's going to increase muscle and blood flow to the muscles. It's going to enable muscles to work more effectively. It's going to improve your ability to do daily activities when you have a regular stretching practice. It also supports parasympathetic nervous system tone and improves bowel movement regularity. This last part really matters in the gut brain axis and in the vital spirit method, right? So when the nervous system softens, digestion moves. So stretching done slowly and consciously is not sympathetic exercise, it's nervous system medicine. And when I'm talking about movement as a seed of health, I'm also educating patients on fascia and the role that working on our lymphatics and our fascia and those deeper tissues, those deeper connective tissues, have in our health journey. So, stretching also works the fascial system, which is deeply connected to the autonomic nervous system. So, fascia responds best to slow load and sustainable stretch and breathing into that and really providing presence. When your fascia softens, your circulation is going to improve. When circulation improves, your lymph is moving, so your detox capabilities are improving. And when your lymph is moving, your inflammation is decreasing. And this is also partly why stretching can feel so emotionally releasing. It's not just in your head, it's actual physiology. And creating optimal flow in your lymphatic system is often a missing piece in a lot of patients' health journey. That's why lymph love is a whole seed of health in and of itself. And remember from our episode on drainage and detox and lymphatic system support, when we're supporting our lymphatic system and drainage, which movement does, right? Because our lymphatics don't have a pump. So we have to move our body, we have to move our muscles, we have to stretch that fascia. And when we're doing that, we are supporting our immune system. We're draining excess fluid. So if you have that sense of feeling puffy or stagnant, it's going to help with that, clearing metabolic waste, regulating inflammation, and certainly playing a role in hormone metabolism. So the key point is really that the lymphatic system does not have its own central pump, and your daily movement activities are the pump. So to support that lymphatic flow, this is really where the lymph love and movement seed of health intertwine. We are going to look toward regular exercise and movement, fascia release, hot and cold showers, including contrast hydrotherapy. This is also movement, right? Dry skin brushing, drinking clean water and enough of it, avoiding tight clothes that restrict our lymph flow, deep breathing, that deep diaphragmatic breathing, maybe doing some rebounding or jumping or heel drops, which is both movement and lymphatic support, and certainly self lymph massage. And remember, the best thing for our lymph is just walking, getting outside and walking. And that's really how movement can support detox in a gentle way without forcing it. It's also why movement is part of any detox plan or program I do with a patient. So I did touch on those craniosacral ball still points briefly before, and I want to use that as a nice little segue into rest as well. So, one of my favorite tools here in this movement as medicine seat of health for patients who are exhausted, inflamed, anxious, depressed. Certainly, if you would describe yourself as someone who feels dysregulated frequently, are these craniosacral ball still points. So now imagine you're back doing that constructive rest pose. And this is a super simple practice. You can get actual craniosacral ball still point like balls, but you can make your own too. And you're going to place them as a prop under the base of your skull or occiput. If you're watching on YouTube, you can see that I have my hands touching the base of my skull while you're lying on your back. Now, if you want to make something like this yourself, you can get 2 tennis balls and put them in a sock. You can get 2 lacrosse balls and put them in a sock. And then you're going to tie a knot to keep them together. And then you're going to place those balls right under the back of your head. Again, I have videos on this. It's a little bit hard to describe, but essentially you can be in that constructive rest pose, laying on your back with these little balls under the back of your head or your skull. So you can just lay there. You might find that you want to move I just got an adjustment doing that. You might find that you want to move your neck around a little bit or your head around a little bit. Just lay there is the essential thing I want you doing, and relaxing. And this is going to encourage parasympathetic activation. It's going to help you release tension patterns. So if you have your occiput held in one place like that, you can start to relax into it and feel where you might hold tension. You'll feel your shoulders start to drop. It will support cerebral spinal fluid dynamics and help your system to downshift. I also just made a video of laying on yoga blocks. So you would lay the blocks flat on the floor and then you put your shoulders on the blocks. And for this one, you're laying on your belly and then you're just letting your forehead drop to the floor. So you're just laying down on your stomach essentially, but you have 2 yoga blocks under your shoulders. So for many people, this is one of the safest ways to access that sense of regulation, to start to understand what state your autonomic nervous system is in. There's no effort, there's no pushing, no moving. You're really just allowing the system to rest. And having a rest and relaxation practice like this also helps with another aspect of movement as medicine, which is bowel movements, because they're internal movement for the body. So we need to talk about movement inside the body too. Elimination is movement. Regular bowel movements prevent the reabsorption of toxins, hormones, and inflammatory byproducts. And moving our body every day is going to support peristalsis, vagal tone, bile flow to the food that we're breaking down, and microbiome balance. So if a patient of mine is constipated, the question is rarely just, give more fiber or give magnesium. It's really, are you moving your body enough? Have we watered that movement seed of health? Are we regulating our nervous system? Is there enough safety and rhythm every day so that we can move our bowels? And one of the things that helps us move our bowels most is my favorite movement as medicine outside of yoga, which is walking. And walking really does support healthy weight and body composition, cardiovascular fitness, bone and muscle strength, muscle endurance, energy levels. It reduces your risk for heart disease, stroke, high blood pressure, type 2 diabetes, and more. And I want this to be super clear that walking counts as movement. Walking can be your movement of choice that you do every day. It is not just, I'm going out to take a 5-minute walk and it doesn't count as my medicine. Walking is medicine. Obviously, if you can work up your walks to 7,000 to 10,000 steps a day, if you need a goal, great. The nice thing about walking too is you can walk anywhere, anytime. It's free and you can do it outside. Because when you add nature to movement, the benefits multiply. So if you just think about forest bathing, for example, every patient I work with is encouraged to move outside, and nature is not optional. Nature is medicine in this practice. And I bring up forest bathing. So research shows measurable benefits for stress physiology, including reductions in cortisol, improvements in mood, and improvements in markers associated with inflammation and immune function when we get outside in the forest. In Japan, they even have certain forests for specific diagnoses or certain cardiovascular benefits. So check out Shinrin-yoku or the research on forest bathing out of Japan if you're interested. For someone who's exhausted, inflamed, depressed, or burned out, the first prescription is not an intense workout plan. It is a walk outside or sitting outside looking at the water. Nature really in and of itself provides movement and sensory regulation, and just sitting outside breathing is so supportive. It will help your emotional processing. So I personally love getting out on my paddleboard and yes, taking walks outside, but just sitting out in nature is part of this movement as medicine as well. And I do want to touch on how movement and sleep or circadian rhythm are related. Movement and sleep are really deeply connected. So, appropriate daily movement improves sleep quality and sleep depth. And morning movement outside, getting your sun exposure first thing in the morning, is especially powerful. I know you've heard me talk about this. Sunlight plus movement is going to anchor your circadian rhythm and clock into the healthy rhythms of the day, supporting a healthy cortisol rhythm where you're producing cortisol and it's high in the morning and then it's coming down, and it's going to help improve melatonin release at night. So this is often why I ask patients, start your morning with a walk. Of course, I do want to mention that movement should and can be fun. Movement such as dancing, joyful movement, ecstatic dance, these are wonderful forms of movement. And I think dance is such a powerful form of movement because it combines music, rhythm, coordination, emotion, and often community. There are studies on dance interventions showing improvement in mood and cognitive function, especially as we age. So if you love dancing, dance every day. If you love hiking, take a hike. If you love swimming, go for a swim. The best movement is the one that you will actually do. Because if you are actually moving your body every day, you're also going to prevent cognitive decline, which is a goal of so many of the midlife women that I work with. One of the most exciting areas of research around movement involves BDNF, or brain-derived neurotrophic factor. You can think of brain-derived neurotrophic factor as fertilizer for the brain. So exercise increases BDNF, which supports neuroplasticity, protects your brain cells, supports learning and memory, and reduces the risk of cognitive impairment and neurodegenerative disease. So lower BDNF is also associated with depression. And movement is one of the ways that your body essentially grows your brain back or helps your brain to make new connections, which is so cool. And movement is going to play a role in epigenetics. So movement does not just change how you feel, it changes how your genes are expressed. Exercise is an environmental signal that influences gene expression through what we call epigenetic mechanisms, including pathways involved in inflammation, metabolism, and resilience. So your daily movement choices send information to your cells about adaptation and survival. And your behavior matters beyond you. So if your kids are seeing you move every day, or kids that look up to you if you don't have kids of your own, then they're more likely to move consistently and have much better long-term health as a result. So your habits are going to influence everyone around you. And just like we can change the world one healthy, regulated nervous system at a time, we can change the world by showing everyone around us that movement is medicine. Okay, so hopefully you are going to be moving your body more this week. And I want to leave you with what I consider the bare minimum, non-negotiable daily movements for human health. If you do nothing else, do these. Walk every day, even briefly. Outside is ideal. Change positions often if you're sitting. Don't sit for hours straight at a time. Set an alarm and take movement breaks. Move after meals when you can, especially after heavier or higher carbohydrate meals. Do one nervous system supportive movement daily, like constructive rest pose or legs up the wall. Do one form of movement that feels good, because joy makes it sustainable. So do something silly with your body every day. Anything beyond that is bonus. Of course, I might use specific movements therapeutically, but that's not what this episode was about. And remember that healing does not come from doing everything. It comes from doing a few things consistently. Movement is not about perfection, it's about consistency, joy, and coming home to your body. And when movement becomes medicine, the body remembers how to heal. So get moving today and tune in next week for another episode. As always, the Vital Spirit podcast is brought to you by Roots Deep Medicine Clinic and the Vital Spirit Method. And make sure that you go download your free Seeds of Health guide so that you can get watering your movement seed of health today. Have a great day.